Thank you, Mr. Chair. Good morning to both of you. My questions will be directed to Secretary Tennis. And first, I'd like to thank you for the good work that you're doing. Not only you, but your staff. The scope of the problem in Pennsylvania is just absolutely enormous. And I still get excited when I say the Department of Drug and Alcohol Programs. And I'd like to thank the other members here, Democrat and Republican, who were here when we passed the bill to create the new department back in 2009. I mean, the bill got out of the House with only a couple negative votes, so almost everybody here who was there voted for this new department. And I know some of the good work that you're doing, absolutely life-saving work. Would you mind giving us a little report on what you're doing? I mean, sure. This heroin problem is absolutely epidemic, and as everybody knows, it's being fueled by the prescription drug opiate problem. We just recently, it's just tragic, 22 deaths out in western Pennsylvania, Allegheny and Westmoreland County, 22 deaths from heroin. And the heroin problem is being fueled by the opiate prescription drugs. I mean, what are we doing about this, Secretary?
Yes, thank you, Mr. Chairman. Yes, it is a huge problem, and it continues to get worse. And as you all know, the heroin problem has been fueled by the prescription drug abuse problem, that individuals, because of a change in prescribing practices that occurred in the 90s, and it sort of ramped up steadily to more and more opioid prescribing for pain management, that more and more people are getting addicted to prescription opioids. Ultimately, their lives are spinning out of control. They can no longer afford to get those or are not able to get those opioids, and then they switch to heroin. And as a result, we're seeing an incredible heroin overdose and prescription drug overdose problem, to the extent now that drug overdoses have overtaken car crashes as the leading cause of accidental death in America and in Pennsylvania. So it is a huge problem. We're working on it in any number of fronts. To try to get to the core of the problem, we've gathered, and I'm my co-chair over here, Dr. DeLone. We're co-chairing a group we just started in December of leading pain management doctors, professionals in the area from Penn, Geisinger, Jefferson, University of Pittsburgh, to identify what are best and safest pain management practices, specifically with regard to prescribing of opioids, because there are other ways to manage pain other than opioids. We've had our first meeting. It was very productive. I think we've settled on those. We've also had there, and this is an example of the kind of collaboration we've had. I think we had 5 or 6 departments there that actually have a touch on this issue. Department of Public Welfare, Insurance, State, obviously Health, Aging, to look at, once we identify what those practices are, what can each of our departments do to promote and drive those practices. And that's really the goal. It's that simple. We've got to get the prescribing under control. And that's something anytime I get a microphone in front of me, I say, because so many of us have had the experience of going to the dentist for some procedure and being given 20 heavy-duty painkillers when we might have needed 2 or 3, if that, and maybe even having refills on them. So doctors are meant to do no harm. But that's not, with a quadrupling of prescription drug overdoses in the last 10 years, that's not being followed. So that's one example. We have an overdose rapid response task force that I started. That's federal, state, and local, both law enforcement, health, and treatment. We've really gathered together emergency responders, folks from emergency departments, DEA, the state AG's office, the state police, and then we've had the Treatment Providers Association there represented, as well as, so what we're trying to do, these areas of healthcare, law enforcement, treatment tend to be siloed. And what happens as a result is the information passing from one discipline to the other can take sometimes a month or 2, and we unnecessarily lose lives as a result. One example, fentanyl has popped up last spring, late spring and early summer in Lebanon County and a couple of other counties. And that's what really started this thing. We were going to say, what can we do to get onto fentanyl fast? And the coroners are really a critical part of that group, and they now have a fast reporting form. If coroners see people who've died of fentanyl overdoses, if we can get that information onto a platform, and the state police have volunteered, they're putting this together for us, this platform with Homeland Security dollars, that information could be made available immediately, like within days, to law enforcement. They could be sending in undercover officers to make those undercover buys and get the fentanyl off the street. Another example, we have a warm handoff group that the treatment providers have worked with us on, and we've actually sent out a directive to our county drug and alcohol directors: work with your emergency rooms. If somebody comes in and they survive an overdose, we need to have a more robust response to get them into treatment, because many people who die of drug overdoses have survived previous overdoses, and we've missed the opportunity. So we've got a good opportunity to get them into treatment. We've got any number of other, I don't know where to stop here, Representative, but...
I would suggest now.
Okay.
Secretary Tennis, I mean, thank you for your good work. You mentioned the coroner's report, and I mean, I would ask the members to pull their coroner's report. I have for many of the different counties. It is just amazing. 3/4 or better of the people that die from an accidental drug overdose are dying either because opiates or heroin were involved. In Philadelphia alone last year, 1,000 people almost died from an accidental drug overdose, and 750 died because of either heroin or opiate drug prescription. The prescription drug monitoring bill, we've got to get that passed. Me and Representative Baker have been working on that for almost 4 years. We've got it out of the House. It's over in the Senate. I mean, I think that'll be really good if we can get that passed. It'll really put a dent in the problem. I just circulated a bill, and just a quick comment. It's a Good Samaritan bill for a limited amount of immunity for drug overdoses combined with Narcan, which is an absolute miracle drug when it comes to opiates. I'm doing this with Representative Frankel. Just a quick comment on Narcan and how good it is and how we should be doing something with that.
Well, it works. And we found, and I'm going to just give you one quick example. Quincy, Massachusetts, they actually implemented a plan where it's a city of 100,000. They gave the police department the Narcan nasal canisters. In 3 years, they trained the police how to use them. It takes about 15 minutes to train them. In 3 years, they reversed 170 overdoses in a city of 100,000. Now think of the impact that could have in Pennsylvania in saving lives. You can't get people into recovery if they're dead.
Yep.
We have to save the lives first. That's got to be our first priority.
And it's a nasal spray. It's easy to give out. And so we're going to look at that. And just real quick, I'm going to leave you with this. A number of weeks ago, I sent both of Secretary Wolf and you, Secretary Tennis, some guidelines for physicians, something that the state of Ohio just did. I think that is something critically important that we have to look at here in Pennsylvania, getting guidelines in place for prescribers for these opiates.
Yes, sir, I agree.
Okay. Thank you, Mr. Chairman.
Thank